It's a phenomenal panel. They talked about scaling innovation. Dr. Chen said the biggest challenge to scaling today is not the need or demand for care services. What our barrier is scale. It's really about how to scale faster. And there's a lot of innovation happening, Chen added. The question for us is, number one, how do we scale faster? And number two, how do you scale the simple rather than thinking about all the overwhelming amount of complexity? Scaling innovation has always been the challenge. A number of times I've had organizations come in to me when I was CIO, and they had phenomenal solutions. I looked at it, I'm like, this is great. And I would say, look, we're a 16 hospital system. We're looking at roughly this. And they'd look at me and say, well, we've never really done it at that size or scale. And some of the scaling stuff, to be honest with you, was on our end. Contracting took months, getting them access to data, the correct data, setting up the interoperability, the security, as we talked about earlier, the security framework and going through those things. Sometimes we bring in these startups and they would be cheering. They got a big one, right? We got a 16 hospital system, a brand. This is going to be great. And 6 months later, they still haven't received a nickel, haven't started the project, haven't get anything off the ground. How do we get past that? How do we scale these things faster? What's going to be the one or two things that helps us to scale these things better?
Well, culture is going to matter in this case. Say culture, and it's a big bang culture. We were a culture. So in academic medicine, we were a culture of innovation. And there was money behind that innovation because we wanted to take cutting edge research from the bench to the bedside. You could see what the outcome was, right? When you get to other areas, contracting, I don't want to bash the contracting people, but that is a lengthy, long process. Well, now we have opportunity to shift contracting, getting to much more robotic process automation to look at what are the terms, what are the conditions. I don't need a human involved in that, right? So I need to change how we're doing some of that work so that we can onboard faster. The innovative companies that are coming to us now in healthcare, they're doing things well beyond the scope and means that we've ever seen before in healthcare. When you talk about like modern application platform stacks, and then I got to go back and work on my behemoth EHR that's running a 4-tier application server environment, those are not the same language, right? So now we have an educational divide at the same time, because what are they actually doing in that space? And sadly, the space that they're working in, much more these innovative companies are more secure, more visible. You understand what's happening there more clearly. So I think the culture and the educational aspect of it is one that just has not caught up yet. I think COVID did some very interesting things to us. It made us scale innovation at a breakneck speed, which we've never had to do before. If you think about just the whole work from home mentality, how many health systems do you know actually had the flexibility for people to work from home? None. We didn't have, we had cafeteria type spacing where you can come in and do collaborative work, but it wasn't because you didn't have an office or a desk someplace else. That was just an area you went to work to share ideas. You then went back to your office. You never worked from home or the cafe down the street or someplace else. Scaling to get just that in, phenomenal event for healthcare. A lot of people did a lot of work. Now try to bring in all these fancy new technology to solve real critical business issues. We're just not there yet. So we got to shift that culture. We got to start to learn more about what's taking shape outside the walls of our hospital. I think that's going to be the start. I love the article because it talks about changing financial incentives, which is critically important, right? So fee for service to quality-based outcomes. We've been talking about that for years. The reality is it just hasn't caught fire for some reason. I put in the first accountable care organization in the Northeast. It still hadn't caught fire 10 years later. How do we get to that point where that starts to really make a difference? Healthcare policies, again, it's great that we create a policy, but policies, just like anything else, are living, breathing documents. They have to be taken off the shelf on a frequent basis, dusted off to understand the implications of it. And we just don't do that well right now at the federal level when it comes to healthcare policy. So there's a lot of things that have to change for us to get to that point where we can create agility and actually adopt innovation within healthcare delivery.